Acute kidney, also known as acute renal failure, is a sudden episode of kidney failure or a kidney damage that happens within a few hours or a few days. Acute kidney injuries causes a buildup of waste products in your blood and makes it hard for your kidneys to keep the right balance of fluids in your body.
Acute kidney injury means that the kidneys have taken a hit that is lasting from a few hours to a few days. And acute kidney disease means that this is going on for up to 3 months. If it goes beyond the 3 months, we call it chronic kidney disease.
According to the specialist, acute kidney injury can have many different causes. It can be caused by decreased blood flow, where some diseases and conditions can slow blood flow to one's kidneys. Dr. Joseph noted that acute kidney injury is also caused by common diseases like malaria, among others.
They may not be direct with the kidneys, but what happens when someone gets sick? They may get dehydrated from vomiting, from diarrhea, from a poor appetite, and they're not taking in enough, or they have lost blood, they are sweating away, they get dehydrated, their blood pressure goes down, and that affects the kidneys. The treatment that we use when managing these conditions may affect the kidneys as well. And when people get generally sick, then the whole body takes a shock, and that doesn't serve the kidneys either. And there are some other conditions that are genetic, that may be inborn, or chronic inflammatory conditions that may take a bad turn.
Acute kidney injury is not limited by age, as it can occur alongside any infection. However, it is a treatable condition.
Before birth, during birth, a few days, weeks, months after birth, anyone can get acute kidney disease, especially because of the things we have seen. It can accompany any infection, can accompany malaria, it can accompany a throat infection, can accompany a skin, GI infection, anything. Any infection can actually turn out to have kidney disease in the process. So the best thing is to look out for it.
Recently, Mulago Hospital registered a successful kidney transplant following the discharge of the patient and the donor. The transplant was carried out on the 20th December 2023 by a team of Ugandan surgeons with support from the doctors of Yashoda hospitals in India. Dr. Ogwavo attributed to this, saying Uganda's health sector is advancing and they are aiming at having more transplants.
The donor is also already discharged and in good condition. So we are here to celebrate that successful operation.
This milestone, never mind how long it has taken to come, but we are very happy and we are so confident now, and we can't wait to do the next one. And we can't wait to make this a routine. Like I said, there's a woman that is giving birth, and it's normal. We want people to have transplants.
He says the ministry has done its best to do primary prevention and the community needs to embrace them. However, there is need to ensure more human resources in the human centers and human power are increased.
There are few. The occupancy of these vacancies at most of the health centers and hospitals is 50 to 60%. So the human resource, the manpower, is lacking at those centers. Now, when we go to the specialized care, say dialysis or transplant, we still have a very long way to go. But it's very positive. We have a law on transplant. 3 years ago, Parliament passed a vote to increase the funding to kidney disease, and we are very hopeful that Parliament is going to give us more.